Person-Centered Care for Patients with Dementia and Alzheimer's Disease by Shatara Jackson. The goal of this project is to equip the staff on the memory support unit with the knowledge, skills, and confidence to provide patient-centered care to residents with dementia and other cognitive impairments. The reason I chose this topic was to find interventions to address issues I have seen working on the memory support unit. Some of the issues I have seen are one plan of care for all residents. This means that there is a generalized plan of care or intervention put in place for residents that resides on this unit. In addition, I have noticed an increased behavior problem in the residents, such as pacing, increased ecstasy, and aggressive behaviors. I contribute these increased behavior problems with having one plan of care that's not personalized for each resident. Also, I have noticed a decrease in functional ability. This meaning residents become more dependent versus maintain independence when reside or move to the memory support unit. My approach for the project is listed here. First, I did research on person-centered care and providing care for dementia patients. After I researched and took online classes provided through my company on dementia care. It was here that I found a lot of approved educational material to help reinforce current knowledge on providing care. And I also used information from my research to provide new knowledge and skills. The teaching plan was hard to construct due to all the information I had that I thought was important. Thanks to the feedback from my mentor, the clinical care coordinator, and the director of nursing, because they helped me to stay on topic and condense my information in a suitable length and service. After my lesson plan was completed, I received permission from my administrator to proceed with my in-service. Residents that are currently impaired require specialized care. The staff that cares for this group of residents required training. The training conducted was for nurses and the CNAs who provide direct care. The target audience for this training was for the staff that works in the memory support unit. The resident that resides in this memory support unit are those that have dementia, Alzheimer's disease, and other cognitive impairments. The training was conducted in one day, followed by 3 days of observation over 2 weeks, and another day of follow-up training focused on giving feedback and reinforcing knowledge and skills. The goal of the training is to equip the staff with knowledge and skills to provide confidence with providing care to patients with dementia and Alzheimer's disease. Some studies suggest providing a person-centered plan of care decreases behavioral problems. During the observation period, the dementia care mapping was performed to track the care provided and the behaviors that occurred. The in-search was conducted in person to allow the staff the option to ask questions or clarification. The in-service took 2.5 hours, which included a lot of time for question and answering. The in-service was broken down into 6 sections. The lesson discussed our overview of what dementia and Alzheimer's disease is. Afterwards, a detailed lesson was given on the care of cognitive impairment with a focus on communication skills. The do nots with communicating with this group of residents, the environment and how to maintain a safe space, and how to for activities of daily living while maintaining resident dignity and encourage independence. The training also consists of educating the staff on creating a person-centered care plan and why it's important to decrease the potential of unwanted behaviors. The person-centered plan of care section discusses ways the nurse can gather information about the resident to create a personalized plan of care. The two main focus was on cognitive assessment, safety, and functional assessment. The nurse in the in-service appeared interested in improving their assessment skills and care planning skills. Upon questioning the staff appropriate care plan for their residents, the nurses all had a generalized care plan they thought was appropriate for all.
Dementia care mapping is a way to implement person-centered care through observation and mapping skills, perform and behaviors. For my observation period, dementia care mapping is what I use to document the care that was provided to the residents by the staff and to observe any behaviors that was unwanted. Here's a sample of the flow sheet of activity performed that I use to document this care the staff provided over the 3-day period. As you can see, I document on skills such as communication skills, using elder speech, eliminating background, and using negative terms. I also documented whether the staff provided a safe environment for the residents. The in-service went very well. The staff seemed to appreciate the care and the in-service that was provided and tried to make changes to how they cared for their residents. On day one of observation, the staff was very active in implementing the new skills they learned from the in-service. By day 3, the staff stopped trying and reverted to previous behavior. Some of the reasons the staff reverted was due to lack of staff or help, activity limitations due to COVID-19, and because the staff was focused on completing the staff in a time frame. For the nurses, they was eager to utilize the new skills in creating a person-centered care plan, but no recent admissions was admitted during the time of observation. I would say the in-service was effective. I would say that the plan of care put in place was effective. Only issue was time management. According to the staff, I should have received input from the staff that works on the unit rather than asking or relying on feedback from management. The staff also recommend that I incorporate information about time management and skills that was realistic for them to implement. From my observation, I have noticed the staff occasionally felt rushed and felt the need to do the staff tasks for the resident rather than let them do things independently. Another area that was hard for the staff to comply with was using positive language rather than using negative. The staff felt that some residents' aggressive measures had to be made to prevent residents from harming themselves. The nurses believe that there is a one care plan that can fit all residents and that over time personalized care can be added. Generalized activities such as music, watching TV was an appropriate activity for all residents. One nurse even stated that she played loud music to give the unit a lively and more fun place. Again, the training went very well and the staff showed appreciation for the information provided. According to the staff, I should have received input from the staff that works with the resident daily rather than asking and relying on feedback from management. The staff also recommend that I incorporate information about time management and skills that was realistic for them to implement. From my observation, I have noticed the staff occasionally felt rushed and felt the need to do the task for the residents rather than allowing them to do things independently. Another area that was hard for the staff to comply with was using positive language rather than negative. The staff felt for some reason aggressive measures had to be put in place to prevent residents from harming themselves. The nurses also believe there is one care plan that can be used on residents on the unit, and over time, personalized care can be added. Generalized activities such as playing music and watching TV are appropriate activities for all residents. One of the staff members I interviewed that was non-compliant, that gave me valid information to help with improvement with the next in-service was Whitney. Whitney is a fairly new CNA to the memory support unit. She was very appreciative of the care in the in-service given and stated she learned a lot. Like other staff members, she was excited to implement the new skills learned, and she was surprised to know everything that goes into making person-centered care plans for the resident. Whitney was also one of the staff members that had a hard time complying with the plan of care. One of the reasons she was non compliant was due to lack of time. Whitney states that occasionally she feels rushed in her care and at times does not allow the resident to perform their own bathing or dress because she is limited on time and have 8 other residents to provide care to while trying to get them ready for breakfast, other meals, and therapy. She also admits getting frustrated having to repeatedly redirect residents from exit doors and out of other resident space. Due to the COVID-19 pandemic, there have been stricter and there have been less activities provided to the residents to help release some of their energy. She said there is no longer an activity CNA on the unit and that trying to find a mutual activity for all residents to enjoy have been hard. When it comes to using negative language, such as do not, she admits she has used it, but at times seen no effect. She believes for the next in-service that information given on time management that was more realistic should be added for her and other staff members.